I have two questions pretty quick. One is if you would address the agave syrup controversy, and it's going around the internet that it's really just high fructose agave syrup. And then the second question, if you could summarize for my notes, if I was to ask my doctor what 3 to 5 tests I should have, blood tests, what would they be?
Blood tests first. Your C-reactive protein, high sensitivity C-reactive protein, a measurement of your inflammation. Ideally, your result should be 1.0 or less, or if you want a gold star, 0.8 or less, because I'm picky. That's your first test. Your second test, the formal name for this is a glycated hemoglobin A1C. But if you just go in asking for an A1C, everyone will know what you want. They'll be puzzled because the test is usually run in diabetics to look at how good their blood sugar is being regulated. But yeah, there's some scientific literature using it in cancer patients. You want your result on your A1C, obviously less than 6% to make the doctor happy, but 5.2 or less will give me a big smile in your direction. 5.2 or less % on your A1C as a target range. The full name for the test? Glycated, G-L-Y-C-A-T-E-D, hemoglobin. Hemoglobin, A1C. Here's how it got that name, really short, quick story. You eat donuts, cake, pie, something of this nature, refined carbohydrate. Your blood sugar goes up. And unfortunately for you, you're having trouble regulating your blood sugar, so your cells can't take all the sugar up, and the sugar stays in your bloodstream. Too much sugar in your bloodstream is toxic, particularly to your eyes, your retina, and to your kidneys. So your body developed a backup mechanism to hide the sugar from these organs so that it doesn't damage your eyes and your kidneys. And that backup mechanism is binding the sugar to your red blood cell. Glycated means binding. So you just bind it to your red blood cell. And this, when the test, they draw your blood and they look on your hemoglobin, how much sugar is stuck there. In a healthy person, 4 to 5% of their red blood cells, their hemoglobin, has some sugar stuck there. If you're having trouble regulating your blood sugar, then you get up in the higher 5s, or if you're a diabetic, you go above 6%. Third and last test, your vitamin D, which is your 25-hydroxy cholecalciferol, or vitamin D3. Those would be the top 3 tests that you want to get. Yeah. Was there another question associated with that?
Agave.
Oh, the agave controversy. 25-OH. OH stands for hydroxy. Cholecalciferol, which stands for vitamin D3. If you say 25-hydroxy vitamin D3 or my vitamin D3 test. Where do you want that to be? Oh, ideally you want your vitamin D between 60 and 80. Even though the reference range is going to come back and saying as long as you're above 30, or you're in California, your reference range is probably 35, you're okay. But for best effect, 60 to 80 year-round. Okay, agave controversy. I actually assigned one of my research assistants to this. So she about 3 months ago, she had a formal write-up that she did about it, and then we're looking at it again. So it's something that we're looking at again. It had come to our attention that there are some brands of agave that may be cutting their agave with high fructose corn syrup. And that, yeah. So that, and at this point, we don't have we would love to have here are the brands we know for sure. What I would do is call the companies, because when 100 people call within the space of a week or two and they're complaining about and they want to know about it, it votes. It tells the corporation or the company, we're aware, we know what they're doing, and this is what we're looking for. So we will, in short, begin to see labels that tell us a little bit more about, this is 100% agave, there's no high fructose corn syrup in here. There may be some assay that the lab has done at the company. Some of the better companies have done this, where they've done an assay to look at the amount of fructose in their agave. It's a concern. Fructose, or corn syrup, doesn't raise your blood sugar directly. It has to go to your liver first before it's converted to glucose. Then it can raise your blood sugar. It has its own problems. It's really hard on the liver. It's very much still a concern for us. I use small amounts of it, but we talked a little bit earlier about this. I want to change your way of thinking. I don't want you to take your standard American diet and replace the hamburger with a grass-fed hamburger, the French fries with, I don't know, sweet potato fries, and the pie with pie made out of agave. We want to have a new model of eating that looks like the lovely meal that you were served for lunch today. So I think that is it's not about I want my sweeteners and now I have a new version of my sugar. It's that there's a small amount of agave in moderation. Thank you, Grandma. And that you're looking for other ways to treat yourself. You know, a piece of fruit, the sweetness out of a piece of fruit or the sweetness out of a baked yam is a much better whole food. You know, it's back to the whole food again. If you can see the whole food and that food was here 200 years ago, you have my thumbs up.